continue with. So I'm going to stop that read. I have another read somewhere else. Here we show you this table that demonstrates to you the very similarity between many of these nerves. Iliohypogastric, ilioinguinal, genitofemoral, the nerves to the psoas major and minor, quadratus lumborum, to the iliacus muscle, the laterofemoral cutaneous, all are pretty proximal, coming from T12 nerve down as low as the L3 nerve. And we all know that it might involve a nerve above and it might involve a nerve below. And then the femoral nerve is L2 to L4, the obturator nerve being L2 to L4, give or take a segment, and same with the accessory obturator. So these all come from a very similar area in the spine. And that means that if you injure just one of those nerves, you might be under the impression that the others are involved, and that's called referred pain. Let me read a brief paragraph here. The common method of formation of the lumbar plexus is that the first lumbar nerve, which may or may not receive fibers from the 12th thoracic, give rise to a major stem that subsequently divides into the iliohypogastric and ilioinguinal nerves, while a small branch descends to unite with a similar small branch of the second lumbar and form the genitofemoral nerve. The second lumbar nerve, in addition to furnishing a root for the genitofemoral, gives origin to parts of both the lateral femoral cutaneous and the femoral nerves from its posterior branch, and to a part of the obturator nerve from its anterior branch. So I'll stop right there. You can review that later, and then I'm going to another paragraph. The iliohypogastric and ilioinguinal nerves are distributed mostly to the skin on the lower part of the abdomen and an upper part of the thigh and buttock. Now this really negates the statement and understanding you'll find elsewhere in anatomical text, where it certainly innervates not just lower abdomen, but also around the genitalia. So, this interesting quote. One more time. The iliohypogastric and ilioinguinal nerves are distributed mostly to the skin of the lower part of the abdomen and an upper part of the thigh and buttock. The iliohypogastric nerve may also innervate the pyramidalis muscle, a little triangle muscle right above that attaches to the pubic symphysis. The femoral branch of the genitofemoral goes to skin of the thigh, and genital branch to the cremaster muscle, and to the skin of the scrotum or labium majus, or majora, in the female. The distribution of the obturator femoral and lateral femoral cutaneous nerves to the lower limb are described with that part. Okay. We will elaborate as we continue to turn pages, and I have another anatomical book that's worth looking at. Now here you can see in the male, this is the scrotal sac, okay? And it has multiple nerves that supply it. The very back wall of it is in fact pudendal nerve, which we're de-emphasizing in this presentation. A lot is known about that nerve, so we're putting it on the back burner. Not to say it's less important, that's not the point. But down below are cutaneous nerves from the posterior scrotal nerve, which surely is pudendal, okay? Now down here in the green is the anterior scrotal nerve. And you see the multiple branches in the trunks, and that is ilioinguinal nerve. Okay? Just lateral to it is the genital branch of the genitofemoral nerve. Okay? And in the female, there's a very somewhat similar analogous type of sensory innervation. Now, I'm going to read this also. Bear with me. I know that reading you know, it's hard to make a video. It really is, and I'm sorry, but I'm driving a point home, and I just got to read a couple paragraphs. It's not a lot. Bear with me, please. The pudendal nerves and the internal pudendal nerve vessels are similar in the female to those of the male, except that the continuation of the perineal branches are called the posterior labial nerves and vessels. These supply skin of approximately the posterior half of the labia majora and that of the labia minora and vestibule. The mons pubis in the anterior portion of the labia are supplied by the anterior labial nerves and from the ilioinguinal and by the genitofemoral nerve, both branches of the lumbar plexus. So it's incredible. You have an area of your anatomy, whether you're male or female, in which this portion here, if you will, has a lower thoracic T12 and upper lumbar innervation. It also, and primarily from internally, has a lower sacral innervation from the pudendal distribution, which is lower sacral, primarily S3 and S4. Fascinating that you've got two distinct regions. It gets even more complex when you look into the autonomic innervation of it. I'm not even going to pretend to understand that. I promise you, I've read it several times. I promise you I don't understand it. But I give it every consideration, and I'll show you the autonomic plexus later on. Continuing this brief read, and you bearing with me, the perineal branches, I'm going to repeat that one statement. The mons pubis and the anterior portion of the labia are supplied by anterior labial nerves from the ilioinguinal and by the genitofemoral nerve, both branches of the lumbar plexus. I have a theory that some women who experience vulvodynia, pain in this area, in the external portion of the genitalia, that it might be a peripheral neuropathy. And my belief is that until we've ruled it out, we don't know. Okay? I said contribution. I didn't say cause. I didn't say primary cause. I'm not negating the pudendal contribution. I'm just trying to shed a little bit of light on, hey, what about these guys, which definitely go to the same region. Okay, that's all I'm saying. The perineal branches of the posterior femoral cutaneous nerve are distributed lateral to the posterior labial nerves, and the skin of the clitoris is supplied by the dorsal nerve of the clitoris, which is pudendal. Okay, that's all I have to say there. And of course, this film is not a detailed anatomical inquiry. It's simply me speaking primarily about these three nerves and describing the rationale for doing that test. And then I'll elaborate on what I call a scratch test on some of the peripheral supply to the skin and the lateral pelvis regarding those nerves. Now, here's a picture of the female, and you can see, just for orientation, this is the pelvic floor, okay? This is the anus, and this would be the tailbone, the coccyx. So you're looking like underneath, okay? And this is the external genitalia, and this is the deep dorsal vein, nerve, and artery of the clitoris, okay? And look how proximal, how very proximal is the ilioinguinal nerve. Now, who's to say that these branches do not also innervate the clitoral structure? Very interesting possibility. And you can see that this branch appears to go medial, this branch appears to go medial, and this branch appears to go lateral. All right, so we're done with this book, and I have a comment about anatomical books. Anatomy books should be well used. They should be beat up. That's why God made them. Now we're going to look at Grant's anatomy. And if you could just quickly show my anatomical bookshelf. It's the third one down from the top. And it's grossly inadequate. If you have some anatomical texts you want to donate to me, I will take them and I will use them. You simply need multiple views to understand a specific part. Anatomy is that complex. It truly is. Okay, we're going to look at some nice pictures here.